Today, we will be announcing 56,621 cases and 5,406 deaths. The cumulative percent of positive tests in the state remains at about 13%, but for the past 7 days, the average is just over 4%. That is really good news. We've also nearly reached our 7-day average goal of 15,000 tests per day. We continue to work with local health departments to expand testing, and this weekend we will again be testing, this time in Mackinac City, Albion, Flint, Wayne County at the Westland Mall, Traverse City, and in Midland. If you will be in these communities over the weekend, please reach out to obtain a test. As I've said before, we've significantly expanded our testing eligibility criteria so that most people are actually eligible to receive a test, and you do not need a doctor's order anymore. We have over 250 testing sites across the state, and to find one, all you need to do is either call the MDHHS hotline at 1-888-535-6136, or you can go to our website, www.michigan.gov/coronavirus test. As we continue to aggressively increase testing and the downward trend in cases continues across the state, in the upcoming days, we will be able to move forward different regions of the state in the next phases of the My Safe Start plan. We also know that we have to protect the most vulnerable from COVID-19, especially people who are living in nursing facilities. Michigan, just like many states across the country, is seeing a devastating number of cases and deaths amongst nursing home residents. To get a clearer picture of the situation in nursing facilities, we've revised the state's reporting structure so that it better aligns with the newly released CMS guidelines at the federal level. We've provided this further guidance to our nursing facilities on these reporting requirements and have released this new updated data on our website today. As of this week, with 91% of facilities reporting, we know that 4,949 cases of COVID-19 have been in nursing facility residents across the state, and preliminarily, we know of 1,216 deaths. Almost 23% of all COVID-19 deaths in Michigan are in nursing facility residents, and we think with improved data reporting, that percentage is likely even higher. These deaths are incredibly heartbreaking, and we take this very seriously. We must do everything we can to ensure that our elderly and our most vulnerable are protected from the virus and are receiving the absolute best medical care. And we also know that reporting data alone is not enough. We now are partnering with district response teams led by the Michigan State Police and local health departments to expedite testing of nursing homes across the state. In addition, we have infection prevention and assessment teams, or IPRAT we call them, and they've been working with local health departments to do assessments of nursing facilities throughout the state. These teams have provided assistance to 278 nursing facilities, and they're doing things like making sure they're implementing best practices when it comes to isolation, screening residents and staff for symptoms, and the use of personal protective equipment. We've also created regional hubs across the state, and they are now approved based on their ability to provide high-quality care to nursing facility residents and making sure they have the appropriate staffing, PPE, and ability to isolate residents. We now have 663 of these hub beds available for nursing home residents who have COVID-19 but do not need hospital-level care. These steps that we've taken are incredibly important and will help to save lives, and we will continue to do even more to make sure our nursing home residents are protected. Finally, as we come to the end of Mental Health Awareness Month, I want to remind everyone that while we often focus on the physical consequences of COVID-19, we cannot forget about the need to take care of our mental health. This is a stressful time for everyone. People have lost jobs, they've seen loved ones become ill and die, or they're trying to work while figuring out how to educate and care for their children, and I certainly am. Since this crisis began, the Michigan Department of Health and Human Services has been expanding available resources to help people through these difficult times. The Michigan Stay Well Counseling Service is available by calling our COVID-19 hotline, and that number is 1-888-535-6136, and you can dial 8. Confidential and free counseling services are available 24 hours a day, 7 days a week, and we also have language translation services available for that line as well. For people who are suffering from emotional distress and anxiety because of this crisis, but they prefer to text someone as opposed to a phone call, all you have to do is text the word RESTORE, R-E-S-T-O-R-E, to the number 741-741, and you can get support 24 hours a day as well. This and other services are available at our website at www.michigan.gov/staywell. I also want to thank the Michigan Mental Health Association. They've had nearly 500 mental health professionals sign up to volunteer their time and services to assist those in need, and we're grateful for their service. This crisis has been difficult for everyone, and life as we know it will be different for a while, but we can get through this. Let's protect ourselves and each other by continuing to wear masks, maintaining an appropriate 6-foot distance from each other, not gathering in large crowds, and washing our hands often. And make sure you're taking care of your mental health, getting exercise, and checking in on loved ones and family members often with a phone call. We truly are in this together, and with our continued patience and vigilance, I'm confident we will beat COVID-19.